Ulcerative colitis is a disease affecting the colon and rectum, and it falls under a classification of diseases that we refer to as autoimmune diseases, where your immune system, which is designed to protect you and help you, is out of order, and that results in inflammation. Patients with ulcerative colitis may experience symptoms like rectal bleeding, urgency to go to the bathroom, abdominal pain, and even severe diarrhea. Ulcerative colitis doesn't discriminate. It can affect anybody. And so if you're experiencing these symptoms, it's probably wise to be evaluated by your physician. When somebody is initially diagnosed with ulcerative colitis, the treatment is typically medical, and that consists of a variety of medicines that bring your immune system into check so that the inflammation can subside. Unfortunately, in some cases, patients develop such severe symptoms that they require surgery to treat their disease. We see this in situations where patients are on medicines that simply can't control their symptoms, or when patients develop severe complications related to the disease, such as things like bleeding that can't be controlled. They can develop perforation or a hole in the colon that results in an infection in the abdomen, or they can develop severe scarring that results in a blockage in their intestine. Some patients that have had long-standing disease for many, many years can even develop colorectal cancer. While the idea of surgery can be quite frightening to a patient, surgery in this setting has the advantage of being completely curative for the disease. Today we have two options for surgery in patients with ulcerative colitis. The first option would be to remove the entire colon and rectum and construct an ileostomy, where the bowel empties into a bag that's placed onto the abdomen. That used to be the only option, but today we have the option of reconstructing the gastrointestinal tract through what's called a J-pouch procedure. In this procedure, we can remove the entire colon and rectum and reconstruct the rectum out of the patient's own small intestine, which is then hooked up to the anus, effectively restoring their gastrointestinal continuity. Patients will often ask which option they should choose, and I stress to patients that both of these options are equally effective in curing their ulcerative colitis. The choice of whether you want an ileostomy or a J-pouch is a personal choice that should be tailored to you, and you should have this discussion with your surgeon. The surgical treatment of ulcerative colitis is complex, and it's critically important that you seek out a surgeon who has experience both in the surgical procedures themselves as well as the issues or challenges that can arise after surgery. Experience counts. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.